we're at that point now where we feel that we can bring patients into the facility. Up to yesterday, the challenge has been one where to get water into the facility because while the facility was there, there's no water connection from the main, the GWI main, into the building. We have been able to work with GWI to help to rectify that. So as of today, GWI is going to bring water, well, not pipe the water, but to bring it with a tanker, put it in the tanks that we have so that water can be there while they do some rectification on the connections that would bring the water from their main pipes into the facility. So water was a challenge, but I think as of today, with the trucking of the water into the facility, um, we have found a solution to that. We are hoping that as GWI continues to work on this problem of connecting us directly to the main, that would probably maybe take another week or so for us to fix. But in that interim period, they will continue to truck water to the facility. The other challenge that we had was one of electricity. Again, this facility was not connected to the main, to the power supply from GPL. Yesterday, the technicians and so forth, engineers from GPL was on the ground, and they have come up with a temporary solution. That is, they'll be putting in smaller transformers, but the way they have wired them would allow for it to successfully take off the load from the Ocean View facility. So as of yesterday afternoon, we started having power from GPL going to the building. This morning, the medical team from the Georgetown Public Hospital would make a final assessment, and I expect by this afternoon we should have patients going into the facility. We are going to be using two sections of the facility. On the eastern side, the lower flat, we'll have persons who are in transition. So these are persons who are suspected perhaps to have COVID, but we're not certain. They would be awaiting their test results. But in the meantime, we'll be putting them in this facility where they can be adequately quarantined, so to speak, because each one of them would have their own room. They would have their own bathroom and toilet, and they would be separated, so there would be no chance of any infection or contamination. So that's one section, and then on the upper floor, we have already made that section ready to have persons who have tested positive, and so those persons would be there. In terms of staffing, we have identified the doctors who would be working there. We have a staff from the GPHC who would be supervising and managing the facility. But in terms of doctors, we have identified, I think, about 28 doctors who would be manning that center. We've also identified nurses who would be there and other support staff. What we will have as of now, once we put patients in there, we're looking at the patients with the milder form of the disease who would be in the upper floor, and they would be closely monitored. So if they move from mild to more severe forms of the disease, we'll have an ambulance that is on standby at the facility to move them quickly over to GPHC so that they can get the necessary support that they require. In the near term, what we'll have to work and do is to create an ICU space right at Ocean View. But as of now, we are not able to do that. So that would take us maybe another month or so for us to set up that ICU space at Ocean View. Once that is up and running, then those critical patients can receive care right at Ocean View. But as of now, we'll have these transient arrangements. The entire facility would be managed by GPHC, so the teams that are working at GPHC would now manage this facility, which offers that integration of care. So I think, I want to thank the staff of GPHC and all the other agencies that helped us to really put this hospital together and make it operational and functional in the shortest possible time.
All right, Minister. We know at approximately 8 o'clock this morning, we had a flight landed in Guyana with some COVID-19 supplies. Can you say exactly what are these items and where would they be distributed to? Do you have any facility that is a priority?
Well, most of the items that we're receiving, they're coming through CARFA. Um, that's the Caribbean Public Health Agency. And they have received donations from several international organizations. So CARFA has been coordinating this distribution to all the Caribbean territories. And so what you were seeing this morning was that they have been dropping off what has been allocated to Guyana. And that include a number of personal protection equipment. What we'll do once we receive it, and we should have collected it already, it would come to the central stores, and at the material management unit that we have at Diamond, it will go there. We have a special section that we have established for COVID-19 supplies, so it will go into that specific area. And then any hospital that requires PPE and so forth can requisition using the normal system of requisitioning. Every donation that we receive, whether it's from CARFA or any other organization, private sector, whoever donate to us, those things go straight from when we receive it, straight to the MMU. They would inventorize it, take it into stock, and then distribute it. And once there are requests from any one of the institutions, we'll be able to issue it through that system. So again, we are very grateful to CARFA and its international donors for sending this set of essential supplies to us. That flight that came in this morning, while it has brought us supplies, it is also taking out the 500 samples to CARFA, and hopefully we'll get those results in the shortest possible time.
But are those the flight taking out 500 test samples?
Yes.
Will this be a one-off something, or if they will continue to help?
As of now, it's one-off because we're trying to clear the existing backlog, but we'll see whether or not they will have the capacity to do this on a continuous basis until we have more capacity in our own labs. Just to, give you a sense of what we're doing, while our capacity might be between 200 to 300 tests per day, many of the other countries in the Caribbean have similar capacity. But we ended up with a backlog because more persons are now coming forward to test, right? So capacity is an issue throughout the Caribbean, but nevertheless we're trying to increase because we recognize the importance of testing.
All right, Minister, and you mentioned that you're supposed to be handing over some ventilators this afternoon.
Yes.
How will this assist or boost the Ministry of Health?
Well, again, this, as you remember, about a week ago, we signed an agreement with the Indian government where they donated to Guyana $1 million US. That $1 million, part of it was used to acquire 29 ventilators. Those ventilators came in the country, so we'll have an official handing over of the ventilators today. And we have already decided where we were going to put those ventilators and the kinds of training that the doctors who will be using them should receive. So once we get them in officially handed over today, within the next couple of days they would be allocated to the different hospitals so that we can improve the quality of care that we can offer these regional and the national hospital.
All right, Minister, and as we wrap up, how would you treat the this issue? We have, like, from the former coalition government, those ministers and so on, especially the former DG Harmon, who headed the task force, and now when he was the chairman, he spoke of person social distancing and these things, but now he's calling for mass protests and so on. How would you speak to those incidents?
Well, I think it's highly irresponsible because COVID, once you violate these simple preventative rules, you were putting yourself at risk. So if you go into any gathering where people are closely together, you don't know who might be an asymptomatic person or mildly symptomatic person, and you can get infected. Um, they, so that's the first thing. So I think it's highly irresponsible to get people during these COVID times to come out and try to protest. Nobody is against peaceful protests. Certainly, we as a government, we are not against that. It's people's right if they have, um, whatever grievances, to be able to articulate those grievances. But we also need to recognize that we are in special times. And the special times that we are in requires that each of us comply with the rules that are going to keep all of us safe. And those rules include social distancing, that we must stay at least 6 feet apart, and that we wear a mask, that we sanitize our hands, and so forth. Now, if you are going to bring people together and they don't observe these rules, then you're putting them at risk, you're endangering their lives, and I'm sure out of these types of congregation that you'll be having, that we'll see an increase in positive cases, because there are a number of people who we term super spreaders, asymptomatics, pre-symptomatic people, who can be in those protests. Who knows? And they would be able to, pass the infection on to unsuspecting people. So again, I would urge them to rethink their posture, because that is going to create more problems for the health system. And as it is, we are having, new cases from some of the areas where I've seen some of the protests. We know that there are cases in some of these areas, and if those persons violate their quarantine or violate their isolation orders, then they can easily be mixing up with others and infecting others. So I really want to urge common sense here, because we need to protect each other, and the only way we can do that is to abide by the preventative measures that we all know has been working.